Thank you so much. I think you gave us a lot to think about in terms of the history and how we got here. And I always say, we can't figure out where we need to go if we don't understand how the problems arose. And so you both talked about this connection between housing and education. And so I'll let you guys decide who wants to answer the question first. But these issues are really deeply entrenched, right? And I think, as you both noted, because they're so deeply entrenched, we get this idea that they're de facto. This is just how things are. And Dr. Jones talked about this in her talk, right? So they often go unrecognized as being the result of policies. And so, Dr. Navarro, you mentioned you had some ideas about how to address this. And Dr. Thorpe, you mentioned, I thought, the pathways. And my question were, where are the points at which we can intervene, where we're not just chipping away at the top of the iceberg anymore, but we're really getting down to those root causes to affect systemic change?
Okay, so I'll go first. What I think we should do is, first of all, I think that we should, on those pathways, I think we have to first be willing to acknowledge that this exists. See, oftentimes no one acknowledges that this exists, and we put up and we talk about everything else around it except the actual fact that structural racism exists. There's systems that are in place that are designed to keep certain groups of people in or out of different things. And I think we need to acknowledge that. And then I think that we need to have a top-down and bottom-up approach to address this at one time. I mean, because we can have things come down from federal level, but I also think that we need to have grassroots at the local municipality level working also at the same time, I think, to be able to start to get things accomplished. One of the biggest things I think that needs to be done is we need to think about looking at, and this is just a start. We have to, in order to change policies, we might need to change our politics. In order to change policy, we might need to change our politics. So we need to think about, we talk a lot about social determinants of health. We talk a lot about environmental determinants. We rarely talk about political determinants of health. And I think when we start thinking about, we want to change policy and impact policy, because Dr. Navarro just showed us how essentially the underlying tone is. It would be very interesting to me to see what party was in the office, what major party was in offices as you go through those different educational bills at that time, and what the makeup of SCOTUS was at that time, because that would be very eye-opening and revealing. But I think one of the key things to do is for us to start addressing these political determinants of health for starts.
I love that. I was going to go ahead, jump in, Dr. Navarro. Sorry.
I was going to say, we see that. So it's really the Nixon appointees to the court when the court becomes much more conservative on many issues, and in particular this issue. And we see this continuing to today. There is not going to be, I just make this prediction, that we are not going to have a court-based solution to this issue for at least another generation or two, given the current makeup of this court. This court is highly conservative today. It is very protective of capital rights, of funding. And so, we could talk about sort of Marxian history, versus critical race theory. But the intersection there is that, capital tends to protect structural inequality. I love your idea about, it has to be local, not just federal. We have seen since 1968, several federal programs and policies and laws that have tried to adjust or address the issue of structural inequality in housing. They almost never work. In fact, it's in some ways worse now because of court decisions, and then largely because of what state and local governments have done. You look at something like housing voucher programs, right? Housing voucher programs almost always focus on keeping people in high poverty areas, as opposed to moving people to high opportunity areas. You look at the IRS's low-income housing tax credit program, which was supposed to get us away from this HUD, where everyone agreed that the housing voucher program had some problems. So we'll try and do a public partnership here, and we'll get IRS to dole out tax credits to states, and those states can then dole out those tax credits to private developers to develop new housing. Well, what happens? The IRS incentivizes developing houses in high poverty areas. They give them extra credit for developing in high poverty areas under the argument that, well, any sort of urban redevelopment in high poverty areas is better than none. The problem is we really need to be focusing on areas with high quality schools. That's where these programs need to go, but they're met with strong opposition from community members there, typically white community members who don't want these projects in their areas. They're met with opposition from zoning ordinances. So we need to look at things like communities that how they define single family dwelling zones, right? Minimum lot sizes. All of these things have racial implications about who gets to afford to live where. There are plenty of states and local governments that have inclusionary housing ordinances, and these are great. But we also have to make sure that this doesn't incentivize gentrification, because if you incentivize somebody coming in creating inclusionary housing by putting up the bare minimum number of low or moderate income units in a essentially affluent development, all you've done is help gentrify. You've kicked out a bunch of people who were living there before. You don't provide housing for them. You're abiding by the ordinance, but you're really gentrifying these areas. We need to do things to move away from steering so that there are stiff penalties for companies and realtors who steer Black families into certain areas and prevent them from looking at houses and rental units in other areas. Use of credit score as a proxy for race, right? Mm-hmm. So that has to end. And I think really we need to increase the access to capital for communities of color. People of color have largely been kept out of the home buying market for, over a century. The number one way that families have of passing on intergenerational wealth is a home. And if you have groups of people who've been kept out of that through government policies, redlining, FHA loans, these Hulk redlining maps, racially restrictive covenants before that, and now all these sort of not really racist, but it's really about capital development. But of course, we know that these have racial implications. They're supposed to be colorblind, but we have these actuarial risk calculations. We can really determine somebody's race without really saying it's race. These things need to end, I think, and that's where we can start to make at least some kind of impact.
So I think you said a lot of interesting things, part of being that idea that often what is race or racialized policies are now hidden behind other issues. And I think that issue of gentrification becomes really important. We have a question from the audience where they were saying is, you've both laid out these issues and some possible solutions, but who? So who are we asking these systems with racist structures to institute? Who should be instituting these changes? And then bringing this back to this particular roundtable, what can this roundtable do to address these systems in order to address obesity? So Dr. Thorpe, I'm going to go to you first on this.
So great. So the who is the people who are in the positions that are maintaining the structures. That's the who is. So it could go from, like Dr. Navarro so eloquently stated, the number of governmental policies. So the government is one, and then there are other corporations that is another group of people is the who that we could think about providing potential recommendations for solutions to this issue. And there was a question about obesity. I couldn't remember that one. I want to make sure I answer it, though. Could you tell me that in a second?
I think the question was, what can this roundtable that's really focused on obesity solutions, how can they interact with these systems in a way to affect changes that will ultimately have an impact on addressing obesity and the disparities we see?
Okay, one quick thing that came to my mind is that to obesity solutions is in these impoverished areas that are highly segregated, a large amount of them are food deserts. Can we think about incentivizing businesses to come in these areas to provide grocery stores there, right? Oftentimes there's zoning problems when in these areas in the highly segregated there will be zoning problems. But I look across town where there are more affluent. There never were zoning problems in those spaces. So I think for us to take a close look at these zoning problems and to be able to have some capital, not just to build a grocery store, how about build a grocery store and employ the people in the community to work at the grocery store, right? Absolutely. And so they can work at the grocery store as well. And so I think we need to think about, that's one quick example that I would use, because when most of the places, these highly segregated areas, they're highly impoverished and many of them are food deserts, and many of the families in those areas have food insecurity. And so being able to place grocery stores or another one comes to mind is being able to have this urban garden in a way that not only have the urban garden, but we have to have corporations and governmental fund capital to put forward to start these things. And with the urban garden, well, check this out. How about having that urban garden, having a school run the urban garden, right? Mm-hmm. And then you put funding into the schools, and you have several things going on with that point. You're developing skills in the schools, a number of different skills. You're putting money into the school system. You're putting money into a community that needs resources, and you're bringing in fresh fruits and vegetables that may be able to start thinking about impacting the war on obesity.
Yeah, and I'm going to jump in to say, I'm a firm believer in two things. One is all policy is health policy. Mm-hmm. So when we're talking about obesity, it's zoning, it's also transportation, it's access to fresh and safe park space, it's maintaining the sidewalk so that people have a safe place to walk to get to those recreational facilities. Also, all politics is local, right? So when we're talking about zoning policy, I think one of the things we can think about is how do we engage with our local mayor and council, because those are the people who ultimately make those zoning decisions. And, often when we talk about people getting politically active and politically engaged, it's an every 4-year cycle at the federal level. But what's really going to have an impact on individual lives and communities is happening at the local level. Dr. Navarro, I don't know if you want to add anything there.
Yeah, I'm not an expert in public health or obesity, but I would say cities, and I take Detroit for an example, it's about 20, 30 miles away. Detroit is experiencing a bit of a renaissance, but that renaissance is being felt unequally. It's really redeveloping the downtown corridor with lots of money from large developers and large corporations. There are lots of ways that we know to incentivize these large corporations to do whatever we need them to do, or what they want to do, in the hopes that it's going to lead to some urban renewal. What I would like to see is some of that funding freed up to give to, as Dr. Thorpe is saying, we can give some of these funds to local grassroots organizations to do things. Detroit is 143 square miles with about 700,000 people. There are lots of vacant lots, and there are lots of community gardens starting in Detroit, but they need more help. They need access to some more capital so that they can remediate soil contamination issues, for example, so that they can get more people involved in leadership positions at the local level, so that you can teach a whole new generation of students. You mentioned transportation. The transportation system in cities like Detroit is in terrible decay, and so you don't have, you're stuck shopping at these local places. And what Detroit did, they finally enticed a couple of years ago Whole Foods to come in. Well, that's great, but we all know that Whole Foods is a rather pricey place to go grocery shopping. I love the idea of having a place that serves the community and where people can buy healthy groceries. It would have been better if it wasn't so expensive, if it was more community minded, and perhaps if it was Black run and Black owned, because Black owned businesses in Detroit have not really been getting the same kind of capital that some of these other developers. They don't get the same seat at the table. They don't have the same networks. And when there is capital to dole out, it goes to the big developers first.
And I think that's a really great point. It's that idea of the seat at the table, right? So there's two things that I think are often missing. One, amplifying the voices of the communities that we're talking about, right? So we often talk about these communities, but not with the communities. And we often go in with ideas of how we can fix that community. And we're not taking a strength-based approach, understanding that these communities have survived through all of these disparities and inequities and exist. And so they have a lot to bring to the table. So I think it's also, when we're talking about what are the solutions, it's important to remember that we have to listen to the communities because they have ideas about solutions that are going to work for them as well. And I love that idea of amplifying the voices, as well as recognizing when we're talking about, access to food, making sure that the foods that are being brought in are culturally and ethnically appropriate, right? So I've worked in nutrition, and I recognize simply telling people to eat foods that they're unfamiliar with or uncomfortable, have never experienced, is not going to work, right? We need to really dig down much deeper to understand and to listen to the communities that we're working with. One thing that I thought was interesting, and Dr. Navarro, you're in Michigan, and Dr. Thorpe, you mentioned Flint. And I think that that's a good example of how policies unrelated directly to health, but were really about socioeconomics, have an impact on health outcomes that often seem disconnected and unrelated. And because you both brought that up, I was interested in hearing sort of your perspectives on the thread that runs through that brought us to Flint, Michigan.
I think the thread, first of all, there was no thread. In my view, there were no thread. If there were a thread, it would have been, in my view, it would have been a coordinated effort. And once the story broke, we don't know what was happening really before. But I think what the problem is that we have all this siloed work in different sectors. We don't have sectors partnering together to work together on these common things. Because you made a mention of the health in all policies. I totally agree with that. And I think what we don't have now is we have very little of it. I like to see more of it, is that these different sectors are working together. For example, transportation sector working with the aging community of how to get people to and from the doctor, or having the education sector work with the transportation sector and things like that, having people work together to tackle these problems. What I've seen most of the time is that we have these different sectors working independently on the problems, but I think when we make some small incremental advances, I think if we have people come together across different sectors and leverage the expertise and resources, we can make much bigger advances toward having obesity solutions.
Yeah, I would just say, the recent history of Flint is definitely linked to the longer running racialized history of deindustrialization in the United States. And in fact, I think in some ways it's actually linked to the history of Detroit. Both cities experienced similar patterns of white flight. And so what happened in Flint was Flint was on the Detroit water system. You had massive white flight starting really in 1950, in the 1950s, but certainly after 1967 and the Detroit riots. So massive white flight out of Detroit, a breakdown of the tax base in Detroit, deindustrialization. The Detroit water infrastructure was in, and still is, in a sad state of disrepair. It's an incredibly expensive proposition to run, therefore. And so the ratepayers have to pay more and more. I don't know if people are aware, but before the Flint lead poisoning crisis broke, there were stories of thousands of Detroiters having their water turned off. Because they were they owed so much money on back pay for their water bills. And so there was this whole issue locally here about, we need access to water. That's, talking about health disparities. You have thousands of homes in Detroit that are cut off from water. Flint then has an emergency manager appointed by the governor of Michigan in this very patriarchal law that says that negatively impacts many Rust Belt African-American majority cities in Michigan. That says that the government can appoint an emergency manager. That emergency manager comes in and makes what seems to be purely a financial decision, but has all these ramifications. because Flint didn't have the money to pay Detroit for its high water rate, they were going to use this older system that had been shut down for decades until a new system could be built. So they're going to use the old Flint River system. Flint River is incredibly polluted. People dump refrigerators and cars and truck tires in there all the time. And so it's really no surprise. The writing was on the wall for decades that this was going to happen. And, you know, the argument has been, well, it was just a series of unforeseen consequences. I would strongly disagree with that. We have seen this come. We may not have seen this particular crisis in this particular way, but we know what happens when there's white flight from cities, when there's capital flight from cities, when those cities become disproportionately communities of color. We've seen this for, you know, at least half a century, if not more. So the writing was on the wall.
Thank you. Yeah. And I think that's a really good place also to sort of start wrapping up, is this idea that what often gets framed as unforeseeable or unknowable root causes, we know, but we simply choose not often to recognize. And so, you know, I think awareness is a big first step, but I think we've also discussed a lot about how the next step really needs to be digging down deep to address and to find some of those solutions, which we will all be talking about more in session 4. So I want to thank both of our speakers for being with us today. I think you shed a lot of light on areas that we definitely need to learn and think more about. We're going to be taking about a 15-minute break now for the workshop. And I hope everybody comes back at 12 o'clock, where we'll be talking about the intersection of obesity and biased mental models, stigma and weight bias, with Dr. Carlos Crespo, Stephen Bavon, and Mr. Keith Norris. Thank you, everyone.
Thank you.